thank you very much. Good to see you virtually. It's actually very nice to see that close to 100 people are connected, what shows the importance of having this meeting. So particularly want to thank Marcela for putting the whole thing together, but very especially Andy and Jarbas. So Andy, for all your support throughout these weeks and your work. And Jarbas, thank you very much for accepting to join in a short notice. It was very important for us to have the perspective, the joint perspective from the health side and from the economic side, because that's precisely what we are trying to bring to the conversation, that we should not be talking about the health measures, the response to the health emergency without looking at the economics that underlie these decisions, in the sense that they will have very important economic implications. So Andy has been working very thoroughly on bringing this framework to bring the two things together. And we're launching today, as many of you know, colleagues in the region, we're launching our policy document, COVID-19 policy document series later today. And the first paper of the series is written by Andy and it's precisely about this. So I don't want to be the one talking in this conversation, so I just wanted to introduce the main actors that made this possible, and particularly also thank our colleagues in the country offices who are basically in the front line of interacting with governments to try to come up with effective responses. So it's great that they are joining this conversation. So I will leave the floor to Marcela to moderate, but we will all be following the conversation with a lot of interest. So thanks again to the speakers, and Marcela, thanks for organizing. The floor is yours.
Thank you, Luis Felipe. We are going to have two 15-minute presentations, starting with Jarbas. Then Andy will follow, and then we will open the floor for questions from the audience. So Jarbas, please, let's put on your presentation, and you're on. Thank you.
Okay, thank you, Marcela, and thank you, Luis Felipe. It's a pleasure to have this conversation. I think that this is really a very important matter, not only for the health sector, but also to review very carefully the social economic implications and how states and our UN family can work together on this topic. Let me see if I can share my presentation. Okay, Marcela,
yes.
Can you see the presentation on the screen? Okay.
We can see it, and I think you can, you just need to click to make it large. Right there.
Okay. So, okay, let me start. The Pan American Health Organization, we are coordinating the response at the regional level as the regional office of WHO in the Americas. But let me tell you that this is a very challenging topic that you asked me to talk about, because we are at the very beginning, let's say so, of studies and evidence that can show what is the impact of the many social distancing measures that that many countries in the region and worldwide have been implementing. First, I try to talk about the taxonomy of what we call non-pharmaceutical intervention. That it's a very broad range of interventions, from personal protective measures that each individual family can adopt, some environmental measures, the social distancing measures themselves. For these social distancing measures, the countries, they are not enforced to report it to WHO. about them. Under the international health regulation, they need to report to WHO all travel-related measures, but for social distancing, we are collecting information from our member states, but they are not enforced to do that. Maybe this will a point to be reviewed in the international health regulation in the next years. A very important challenge is that the definition of measures are not standardized. So many countries are calling lockdown different things that they are doing. Ban of mass gathering and others. So we are still trying to provide some kind of standardization to support the analysis of the impact of this intervention. Second is that, as expected, we are in the middle of a public health crisis. We are testing, and the countries are testing measures that sometimes after 1 week, they change, or after 2 or 3 days, they change, they adopt new measures. So we have a very rapid changes of measures. We have in-country homogeneity measures implemented in different states. So even here in the US, we have different levels of lockdown or social quarantine or social measure distances in each state. In some countries in Latin America, mainly the federal countries, is the same. In Brazil, some states are adopting some measures that it looks like lockdown. Other states are not adopting them. So we don't have this homogeneity in countries. And also the compliance with this measure is relatively unknown. Recent days, we are using some indirect information from cell phones company or traffic information, trying to get some measurement about what is the compliance of the population to these measures. The rationale around this measure is that we need to slow the transmission and flatten the epidemic curve. This is a fundamental action that we need to adopt, because even in the countries that we have a very good rate of intensive care unit beds by 1,000 population, the experience that we have learned so far from Italy, for instance, and some cities in Spain, and here in New York, is that during the peak of the pandemic of COVID-19, some services, some hospitals, some intensive care units can be completely overwhelmed and cannot respond to the needs of the population. So it's very important to adopt measures that can slow the transmission. So this will reduce the pressure on health services. In the same time, we are buying some time to have a medicine, a specific medicine that will be recommended, or rapid tests that work better than the current ones. So it's very important also for this reason. This is a graphic that is shown even in the situation that you have the same number of cases. It is totally different. If you have a epidemic curve like the one in the left side, on the left side of the slide, without no measures to slow the rate of infection. So the number of cases can be the patients that will need ventilators or intensive care units bed probably will be totally disproportional with the availability of these services. If you can adopt this measure and to slow the transmission, these cases will be distributed in a more flattened curve, so the capacity of the healthcare system will not be surpassed. And we also need to take into account that the health professionals, they are exposed. So we are seeing in many hospitals and in many countries that they need to implement social capacity to replace health professionals that are getting infected, and when they get infected, they need to be isolated. So this also can reduce the capacity of the health system. Some measures in the region of the Americas, as I told you, they are not enforced. They have no obligation, but we have daily communication with the Ministry of Health, and we have many information. As you can see, at the beginning, only 11 countries implemented the travel-related measures, banning flights from countries that had the outbreaks and other measures like that. Now we have 30 countries that are adopting these travel-related measures. Social distancing, also at the beginning, it was a very small number of cases, but when the information about the efficacy of some measures that were adopted in China, this kind of measure was rapidly adopted by many countries, and with very important difference between the measures. We have now 34 member states that informed us that they are adopting some kind of social distancing measures. From the information that we received about the measure related to travel, we are concerned about the measures that can significantly interfere with international traffic. This is important not only for other sectors, because people that cannot travel, probably for some sectors this is very crucial, but also the impact that these measures have on the logistic chain in the region. So, for instance, we are we are having conversations with the Air Force in many countries to ensure that they can have a flight, so we can provide the laboratory kits, so we can provide the vaccines, not vaccine for COVID-19, but vaccine for the national immunization programs, because we have a regional purchasing mechanism and others. So the countries started banning flights from China, and they were broadening the scope of the banning, and now 30 countries have adopted this measure, but they are less and less effective, even to reduce or to buy some time before the beginning of the local transmission, because we have now more than 160 countries that have already reported to WHO. Here is the distribution of this in a graphic, as you can see. Since the first month of the pandemic, only 3 countries have adopted entry ban from China mainly, but now we have almost every country, I think the exception of Mexico and Nicaragua and some countries, but almost every country has adopted some kind of travel banning measure. Social distance measure also, you can see in this in the columns that many countries now, almost more than 35 countries are adopting. In the red part of the column is quarantine policies. The light blue is limited public gatherings. These are the most common. The third is schools closure. Children are not affected in the sense that they are not a vulnerable group for severe forms of COVID-19. But children can play a very important role to increase the velocity of the transmission. So for this reason, closure makes sense to be adopted in many countries. The fourth one is about the public services closure. The fifth partial, we are calling this partial lockdown. Okay, what to implement, what we are looking for, that clearly some measures concern a small proportion of individuals, while others, the population as a whole. So it makes a very important difference about the impact of the measure, that the different combination of measures can be considered. We are recommending countries that they need to look very carefully about the dynamic of the transmission. So when they implement, they need to implement in the optimal moment that measure, and also to make an assessment about the impact of social and socio-economic impacts that can be produced. A combination, sometimes you cannot, we don't have evidence to recommend that you need to adopt these 2 or 3 because they have a synergistic way to work together. So unfortunately, but many countries are adopting them, and sometimes some countries need to adapt and to adopt new measures during the process. And we have different degrees of feasibility and acceptability by any given measure across the countries. This is expected. And for this reason, it's very important to have a very good and strong coordination, not only the role of the health sector, but the role of the head of states, the role of all the governmental sectors, but also private sector and for sure civil society. When to implement as soon as possible, after the termination of the transmission scenario. So if a country has only 2 or 3 important cases, of course, that was not the moment to implement. This was too early. But when there is the first signals of community transmission, this is the moment that you need to act in order to provide the proper measure to slow the transmission. Prudent to plan for the implementation for at least 2 to 3 months. We are in countries that are talking about 2 weeks only, but in general, at the end of this period, they are seeing that they need to go further than only 2 weeks. So, of course, that is very important monitoring every day what's happening with the transmission. But I think that also to have more confidence from the population, is better to be very transparent about the time that you are planning the implementation. The discontinuation of measure at once in a staggered manner is a strategy that we are still trying. Let's say so. It's a kind of a huge social experiment about this. But the discontinuation also needs to be supported by a very precise monitoring process with data from hospitals, from the incidence of the disease, the mortality. So they need to see what's happening. If the country is ready to discontinue the measures, all the measures, or to reduce some of the measures and keep on monitoring, and if it is needed to adopt the new measures of the level. The very important point is to monitor the level of saturation of health services. This is what we want to achieve. We don't want people dying because they don't have access to ventilators or to intensive care units. So this is the ultimate goal, is to keep the capacity of health service to provide assistance to people who need them. And also, we can use some modeling. We have one, PAHO developed one modeling with collaborative centers that we have, but we are telling the councils to be very careful. This is not a prediction about what will happen. This is useful only for planning purposes. How to implement, I think that's very important. I am finalizing. to adopt a whole government approach. I have already highlighted this. To get consensus across all administrative levels. We are seeing some countries that there are disagreements between the federal government and the state governments and the municipalities, and this is not good. This is a very bad message to the population. Countries needed to, some countries needed to make adjustment in their legal framework to provide legal support to these measures. It's very important, the provision of financial protection, fiscal protection, because this measure will produce a very important impact on the social and economic of the country. And also to guarantee the logistics to ensure the delivery of essential and humanitarian services, supplies, and aid, food security, access to health services, transportation, and others. This is also very important to continuous communication to the population, to explain clearly the reasons for implementing and/or modifying, adapting new measures. What are the outcomes that you expect? What is the estimated impact on the transmission of the COVID-19? And also practical, very practical, objective administrative instructions to increase compliance. Sorry.
We're stopping there? Yeah.
Yes. This is in summary, we are, every country in the region, I think that the only exception is Nicaragua, so far, are implementing different levels of social distancing measures. And for sure that it's very important that they need to be transparent, they need to be very objective, and they do need to monitor all the impacts that this will produce. The good ones to slow the transmission, but also the economic and social impacts. Thank you.
Thank you, Jarbas. We're going to give the floor to Andy Neumeyer for 15 minutes. Go ahead, Andy. You're muted.
Hi, you have to allow me to share the screen.
Jarbas, I think you have to unshare your screen.
Okay, let me see how I will do that. Okay.
Andy, you should be fine now.
Okay, I think that the screen now is...
I think you're fine, yes. Thank you.
Thank you.
Okay, so thank you very much for organizing this. Thank you, Luis Felipe, Jarbas, and Marcela. We've all been working very hard in these last several weeks with these issues. I think that this initiative of UNDP together with PAHO is really, really important, and I value a lot the fact that we are doing this from the health and economic side of the problem at the same time. I've been talking through the Center for International Development Growth Lab at Harvard with several countries all over the world in the last 2 weeks. And one of the things that we saw is that there was no clear coordination or a joint strategy between the financial and epidemiological aspects of the crisis, and the two are very intertwined. So I really thank the UN for bringing, at least here, the two sides together. And I guess that was the last message of Jarbas as well, so we are in the same page here. What I'm going to talk about today is there is some background material. This policy brief here, I think that UNDP is going to distribute it later today or soon. And then we are trying to model what's going to happen after the NPIs are lifted with a group of people at the World Bank and the University of Washington, St. Louis. And there's going to be a webinar on this tomorrow. So let me start by saying that the situation for Latin America in economics is very, very difficult. It's like when it rains, it pours. Like, think for a second that every Latin American is immune to COVID. Even if that would be the case, and there are no, and none of the, and none of the
Please mute your microphone.
Can you hear me?
Yes.
Okay. So even if none of the measures that Jarbas was talking about were implemented and we were all immune, Latin American countries would still be in problems. Like, the price of oil fell to record lows. That would put Colombia and Ecuador in a very difficult situation. Tourism and remittances have been severely hit, which is something that is a very big shock to the countries in the Caribbean and in Central America. There are many countries that have current account deficits, and the flight to quality and the sudden stop in capital flows that they might experience would also be a very important shock. So now Latin America is facing all these shocks, and in addition, the social distancing measures. So the policy response from the economic point of view is very, very challenging. Essentially, we have fewer resources and bigger needs. So here is an example. Commodity prices, this is the average of commodity prices from Bloomberg. It fell 25%. MB spreads, even for the better credits like Peru and Chile, doubled. Just to give you an idea of how big the shock to remittances is, Honduras and El Salvador have 20% of GDP in remittances. And we know that in some of these countries, remittances have already fallen by 40%. So that is like an 8% drop in foreign income, just from the remittances alone for Honduras and El Salvador. So even without COVID, this is a very difficult situation. Now, Jarbas covered this better than I did. This is just my drama slide. Just to make the point, the restrictions on human interactions are very, very big. Currently, there are 163 million people in lockdown in Latin America. Of course, as Jarbas says, lockdown means different things in different places and compliance is different. But another measure of how extreme the situation is that there are like 1.4 billion students in the world. Everywhere you can see it in this map, that are staying at home. Now, what is the effect of this? Like, nobody knows is the answer, because we don't have any measurements yet. There are some estimates that international organizations are, and some investment banks give, but there are a lot of guesswork because they have to estimate how it's going to be the recovery, they have to estimate which share of output is affected and so on. So, because this is so difficult, I just want to give you some ideas about the order of magnitude. Think, for example, that 25% that 50% of economic activity is that these shocks affect 50% of output. So here you have the share of output, and here you have how much the output is going to fall on average in the sectors that are affected. So if 50% of the economy is affected and they lose 50% of output, the fall in income, while the MPIs that Jarvis mentioned are in place, would be 25%. So if they last for 2 or 3 months, let's say 3 months because it's easier, like Jarvis said, that means that GDP from one quarter to the next will fall 25%. To give you an idea of what this is, during the Great Depression, that for some reason is called the Great Depression, the world GDP fell by 27% between 1929 and 1932. So there is no question that this is going to be one of the biggest macroeconomic shocks we have seen. Now, that's not all the bad news. There are many indirect effects because what these social distancing measures do is they close lots of industries that are intense in contacts, like sports, entertainment, tourism, travel, restaurants, and so on. And they also restrict a lot the ability of people to go to work. And that's why the direct effects can be so big. But then there are ripple effects of these things. First, in the affected sectors, either because they cannot open because they don't have the workers, or because it's forbidden for them to open, cannot sell goods and services, but they still have to pay wages, they have to pay their debt, they have to pay rent, they have to pay taxes. So they have what economists call negative value adding. Instead of taking some resources and making more, they make less with what they get. Households, some of them, especially in the informal sector, will have no income. Others might have income, but they might have a lot of income uncertainty if they are afraid that they might lose it. And in Latin America, this is a very important problem because it depends on the country. Between 40 and 60% of the labor force is in the informal sector. But these people still have fixed costs like consumption, rent, and so on. The government that is supposed to come and help to moderate the pain of people and firms also is going to experience a fall in revenue and a demand for more expenditures. So this is a shock that is hitting everybody. And this has many ripple effects. And under this situation, people are changing their portfolios big time, demanding more liquidity because they want to be sure that even if they lose their income, they can consume. Firms want to pay the fixed cost and they can. Also, firms that want to protect their organizations are going to fire workers. Some governments are offering these firms loans, but they might use the loans to just protect their most valuable workers, but not all of them, because they need a survival strategies and they don't know how long they are going to be closed. In this context, the credit of these firms become very risky. They are less eligible for credit. The value of firms is falling. This might have an effect on the capital of banks. And we saw 10 years ago during the global financial crisis, what can happen when banks lose their capital. On top of that, production networks and supply chains are disruptive, which is something that Jarbas was also mentioning because of the restrictions on transportations. Also, in some sectors that stay open, there is telecommuting, telework, but that's much less efficient in many situations than the day-to-day interaction. So this is a situation that is very difficult. So some countries where the government can issue debt have issued a lot of debt to try to help to make this problem easier. And for example, in Latin America, Peru just launched a package for 12% of GDP, the United States for 10, Denmark for 12. These are the magnitudes we are talking about, okay? And just to dramatize this, I don't have data for Latin America, but last week, the number for initial unemployment claims in the United States was published on March 21st. And you see here that the new people filing for unemployment insurance jumped from 280,000 to 3,002,800. So in 1 week, there was a jump of 3 million people looking for unemployment. That's 1% of the population, including everyone in the US. And this is a time since 1967. This is a global financial crisis. So you see that this is unprecedented. It's consistent with what I told you before, that this is going to be a macroeconomic shock of some size that we have not seen before. Now, in Latin America, as I said, we have a problem because a large share of the population is are informal firms and workers. This poses a challenge because even if we had the money to help them, it's going to be very hard to channel resources to these people to help them in this difficult situation at the speed with which these things are developing. Also, there are low levels of financial inclusion in Latin America. Financial systems are very small. So even the help to the formal sector through the financial system is going to be much more difficult in Latin America than in other regions, and especially in the poorest countries in Latin America that are less developed financially as well. And then on top of that, many Latin American countries have very limited fiscal space. Peru is an exception. So the type of help that we're seeing in developed countries is not feasible in Latin America. Here you see data from the World Economic Outlook of October 2019, where you have on this axis the sovereign debt net of the assets of the government that are international reserves and the liquid securities that the Treasury might have. And here you have the deficit. The red dot is the primary deficit, and the blue dot is the primary deficit plus the deficit due to the interest on the debt. So here you see the well-behaved countries in Latin America, Paraguay, Peru, and Chile. And here you see how the years of following a fiscal rule, being disciplined, and so on, is allowing Peru now to be able to borrow and to do the 12% of GDP expenditure. Panama just issued a bond for $2.5 billion. Peru is likely to issue that as well. But then for some other countries, it might be very difficult to issue new debt. Bolivia has big debt, a big deficit. It's going to be very difficult. Ecuador is on the verge of restructuring its debt. El Salvador and Ecuador are dollarized, so it's also difficult for them to take advantage of the fact that people want more liquidity and to print the money. Actually, it makes it worse for them because they cannot supply that liquidity because they don't have more dollars. So the situation is very difficult. So what are the economic policy implications that we wrote with Constantino Evia in this UNDP document that will come out? The first thing that the financial authorities have to do is to create as much fiscal space as possible to be able to spend. This means maximize the borrowing that you can get from official sources. If you can issue as much debt as you want, not long-term debt, because you might not want to pay it forever, but 5-year debt. We don't know how long these NPAs will be in place, so the more cash we have, the better off we are. This need for liquidity that I talked about for the private sector also applies to the government, and in the same way that firms and households are doing, the government has to reduce all the spending that is non-essential for what's going on right now. Also, because it's necessary to help people fast, it's very important to leverage the strategies on existing institutions. Use a financial system to protect organizations in the formal sector and expand existing programs to reach the vulnerable population, whatever each country has. Now, I haven't talked a lot about the formal sector, but I want to make the point that is really, really important. Even though Latin America has a lot of people in the informal sector, most of the output is produced in the formal sector, and then the people that are very productive in the formal sector spend money on the informal sector. And we know from previous work and previous recessions that if a firm disappears or employment relationships are broken, it takes a lot of time and a lot of effort to, my time is over. It takes a lot of time and a lot of effort to find new employees, or if I'm going to restart my firm, until I have my working capital again, until I find employees and so on, that takes time. So these organizations are part of the capital stock of the country, and it's important to protect them to the extent that the government can. And also, when we do all these things, we have to remember that there's life after COVID-19. So when we do all this, we have to plan for fiscal adjustment when we plan the spending. So it's always better to do loans than to do grants. It's better to do tax deferment than tax breaks. It's better to target interventions as opposed to do universal interventions, and so on. And let me finish by stressing how important it is to have an integrated process for epidemiological and economic strategy. As I told you, epidemiological policies have a very powerful effect on the economy. Now, this effect on the economy also affects the compliance with the epidemiological strategy, because if people think that they are afraid that they are not going to have the resources to buy food for the next week, they will go to work no matter what. So, and also when we design the palliative economic policies, we can design them to help to comply with epidemiological recommendations. And also, it's not the same if we plan fiscal assistance to the private sector for 2 weeks, for a month, or for 3 months. So clear communication about the length of the MPIs is very important for the private sector and for the government to prepare for this. And I think that all I've said is summarized in this sign that is from a demonstration that took place in Bogota after the lockdown was implemented, that says that informal workers, that is half of the country, prefer to die of the flu than to die from hunger, locked down in a room while the government is discussing how they can help us. So that's all I have to say, and I'll stop sharing, and I leave the floor to Marcela.
Thank you, Andy. Thank you, Jarvis, for great presentations. We have a little time to take questions. I will ask you to raise your hands virtually. I see Jairo Acuña, you want to go, please?
Marcela, thank you very much. I was writing my question. Thanks very much for organizing this. I am the team leader for governance and peace building in the regional center in Panama. So this is completely new. But my question is, my understanding is that the health issue will not be solved until a therapeutic treatment is found or a vaccine is found. And we are 12 months away. Andy is presenting us the economic implications of these social distances, lockdown measures. So this notion that flatten the curve cannot be extended more than it's already, right? So to what extent, and I guess this is a question for Andy, are we beginning to see a transition to scenarios in which the discourse is not anymore flatten the curve, but slow down the roller coaster of the curve, because these social distancing measures will have to be lessened in order to people to be economically active. And then when they do that, the contagion will spread again. So instead of flattening the curve, we're going to start seeing a roller coaster movements, because households cannot stay longer than 2 weeks at home. Thank you.
So I'm going to be very brief, because I think that this is more a question for Jarvis and for me. In this note that we wrote, we argued something like what you're saying, and we're saying that these interventions are buying time, like Jarvis said, to do something else. And if the pharmaceutical cure is not coming fast, somehow we have to find a way of having more targeted MPIs that are less expensive for the economy. These MPIs are so expensive that what the government has to do is to give all the resources that it can to the health sector so that they can implement the MPIs in a more efficient way. I don't know if that's feasible. I'm not an epidemiologist, so that's why I said that this is a question more for Jarvis and for me.
Jarvis.
Yes, thank you. I think that you are correct. We need to have a vaccine or medicine. Vaccines, we don't expect to have vaccines before 1 year at least, because we have many companies that are working to have a vaccine, but they are still in the phase 1 of clinical trials. Even in the situation that they will adopt a fast-track measures, but it will take some months to conclude the second and third phase and start the production. Medicines, we have probably in a couple of weeks, maybe we will have a recommendation for medicine that can reduce the severity of the cases. Social distancing measures, we know that now is the only measure that is really able to flatten the curve. Because let's look at what happened in Italy, and we are talking about the richest part of Italy. People died there because they needed the ventilators, and the ventilators were not available. They needed the intensive care units, and the beds were not available. So this is a tough measure that needed to be adopted to save lives at this point.
Thank you, Jarvis. Do we have another participant who wants to ask a question? Jose Troya, you submitted a question over the chat. You want to say it out loud?
Thank you, Marcela. Greetings. Thank you, Andy and Jarvas. Greetings from Costa Rica. I'd like to know if you are considering game theory applications to this data, take into account that at this stage we need close cooperation and coordination among governments, and what would be the best way in addressing either the containment or the other strategies to face this dilemma. It seems like a lethal trap between one wall being that the recession and the other the infection. Thank you, Marcela.
Thank you, Jose. Andy, Jarvis, Andy?
I don't know game theory applications, but I think that there's a lot of value to cooperation, and the WHO, the UN, multilateral organizations have a lot to offer in this cooperation, in exploring best practices and letting other people know, procurement of tests and so on. So, but I'm not the UN, so I should not answer this.
Thank you, Andy.
Oh, sorry.
Jarvis?
Yes, no, I do believe that the UN system needs to play a very important role. We are facing many difficulties because the global solidarity now is much more weak than it needed to be. We have countries that are banning exportation of protective, personal protective equipment, for instance. We have countries that are facing very, very important challenges to guarantee the logistic chain, to have access to crucial supplies. So I think that it was very important, the G20 statement about the COVID-19, but I think that we need to work together to be more proactive, to support the heads of state, not only the Minister of Health, but the heads of state, to be the leader of the response, and to monitor very, very closely what's happening. Game theory, I don't know, but many countries, they are applying the toughest measures when the monitoring process is showing that the curve is rapidly increasing, hoping that this will flatten the curve, and they will monitor when is the proper time to release the toughest measures.
On the bright side, the IMF is using all its balance sheets to try to help countries and to do it fast, no questions asked. They are likely to expand their rapid finance facility so that countries can get immediate access to their quotas and maybe even double the quota.
Yes, and just to add, and also the World Bank and the Inter-American Development Bank, if a country has a loan with the bank, the two banks are allowing the countries to use part of these loans to support the response. And some global mechanisms are doing the same. The Global Alliance for Vaccine and Immunization, the Global Fund against the HIV, malaria, and TB. So this is very important because these are funds that are already in the countries, and they can be in a very rapid manner be used by the government.
Thank you, Jarvis and Andy. We are near the end. I just want to stretch the point of the importance that we work together in the territory. We don't yet see all of the governments understanding that this is not a matter where policymakers and economists can work without taking in the voice from epidemiologists who can understand and help us figure how to finance the proper length of quarantines and of other sanitary restrictions, and working together to make this, to transit, I believe, as soon as possible to mechanisms of selective isolation instead of these generalized quarantines is going to be key in order to defend the poor to defend our populations to falling into poverty. So it's great to have you, Jarbas, joining in this conversation. We have several of our regional representatives connected. I don't know if to close, anyone can give us an idea if of whether your government is already taking into account these connections. I know Peru has been a leader and like a first mover in many things in the region. I don't know if Maria del Carmen, you want to say something. I'm also hearing from Eugenia Pisa, who is asking how can we engage populations in this policy discussion. Maybe we can close. I don't know if Maria del Carmen is there, you want to say something, and maybe we can wrap up by passing on this question to both Jarbas and Andy from Eugenia Pisa Lopez from the Panama Hub gender team. How can we engage populations in this policy discussion?
Thank you, thank you. Yes, we're working together with the presidency of the Council of Ministers in order to communicate to the population the different measures that the government is taking into account. And I agree with you that Peru has a quite strong fiscal space to address the needs of the population. They have done this weekly, and every single day the government presents what the measures are to all the citizens in the country. Our preoccupation is mainly with the most vulnerable in terms of the migrants and the indigenous population. We are addressing this as UN because of the isolation that these communities have and the possibility of not having access to health services in the places they are located. So we have a lot to do. I agree with Jairo about the roller coaster. Right now, the president is announcing the possibility of the schools going back to normal functioning on May the 4th. We'll see what happens. I think they're gonna take steps little by little to see the reaction of the epidemiological situation in the country. But so far, the measures have been accurate, and the population has accepted it very well. Thank you.
Thank you, Maria del Carmen. Andy and Jarbas, back to you for closure. And we could address in the closure this question from Eugenia. How can we engage populations in this policy discussion?
Okay, may I start? Eugenia, I think that this is a very important question. I think that for this reason, what we are observing in the countries, first you need to have a clear message to the population. So in many federated countries, you cannot have this kind of dispute among the president and the governors, and the federal government says one thing, the local government says another thing. I think that this is in an emergency like that, the authorities needed to give one message, and one message that's based in science and in a very clean, transparent way. Second, I think that is how we can deal with many different situations that we have in a population. The most vulnerable population, people that live in a slum, how can they use some social distancing measure that we are proposing? This is the kind of question that the government needs to be, and to be open and transparent. I think that this is also key. Thank you.
Andy?
No, I just I agree with Jarbas. I think that clear communication is important. I also understand that clear communication is very, very difficult, because it's very difficult for government to tell people you have to be in a lockdown for a long period of time. So I think that clear communication, democratic debate, decisions that take into account the spillovers are the way to go. And this is uncharted territory, it's very dynamic, and people are making decisions every day.
Andy and Jarvis, thanks a lot for a very motivating conversation. We have had, we still have 146 people connected. We have had up to 2,000 during your presentations. I think this has been very motivating, at least for me, and I think for the messages that we send to our country offices in the region about the topics that we think should be at the center of the conversation in this such complicated juncture. I want to remind everyone that today we will be launching a series of policy documents that should help us raise a voice in things that we think are key for the region in the current moment. The first one was written by Andy Neumeyer and Constantino Evia, and you will have it in your hands today. Thanks a lot, and I think we can get disconnected. Thanks for a great webinar.
Thank you.
Thank you.
Bye.